Part two. So they did chest compressions on her, and ultimately the Code Blue team was able to get her heart started again. So they took her quickly to the operating room where she was able to deliver baby Carlitos. The sequence of events that are listed in this lawsuit from when she was admitted, from when she arrived at 4 p.m. to when she was admitted, like 4 hours later, she was good. Her health was good. Her lungs were good. Her own persona, she was good. They both arrived thinking this is just going to be 24 hours for observation that the doctor ordered. To me, honestly, I think the first red flag should have been for when her magnesium sulfate was registered as high, which was at 11:25 p.m. I'm not a medical professional. Do not take this as medical advice, but this is just my own personal opinion that as soon as her magnesium was registered at high, something should have been done. They didn't end up removing the magnesium sulfate until 2:59 a.m. That is just, and I don't know if this is what was causing that, because we all saw on my first video that when your magnesium level is at a high, you can't breathe, and so her not breathing was causing her anxiety to spike up, her heart rate to spike up. So it was just, everything was causing this, and the hospital staff was just there trying to figure things out on their own instead of doing what they were supposed to do, because according to this, the standard of care is more than clear that there should have been a protocol to follow, and they didn't follow. This was not a normal pregnancy. Diana was 29 years old, 32 weeks of gestation, or she was 32 weeks pregnant. But when she was admitted to labor and delivery, she was admitted and required treatment for her blood pressure, required magnesium sulfate for seizures, and she also needed continuous fetal monitoring. She was in there for her preeclampsia. So it was not a normal patient, and she should have been monitored frequently by that nurse that was assigned to her, especially to look out for signs of any magnesium toxicity, any progression of her preeclampsia, or any findings that were consistent with cardiorespiratory deterioration. Why? Because magnesium sulfate does this. Magnesium level over 10, muscle paralysis, apnea, respiratory failure, complete heart block, cardiac arrest. The nurse that was in charge should have checked her vital signs every 15 to 30 minutes. Physical examination should have been performed and documented every 15 to 30 minutes. The standard of care is that the nursing staff should have recognized that this particular patient was at risk of pulmonary edema, respiratory distress, and hemodynamic instability. So the protocol, this is what the protocol should have been. The nurse should have alerted the charge nurse and the patient's physician. They come to Diana and they try to seek intervention to avoid further decline in her health. If this intervention is not successful, then they have to call the rapid response team to warrant the support of the patient's cardiorespiratory status, and if needed, prompt delivery of baby Carlitos. As soon as Diana went from, yeah, she was breathing fine, to no, she can't breathe, we heard water on her lungs, she was uncomfortable, like all of this, it was just, it's negligence to the max. And all of this I'm reading, and it's overwhelming. It's taken me several days to intake what Diana had to go through, what baby Carlitos was put through, and especially what Carlos was going through. He was witnessing all of this and his inability to do something for his wife or his baby. I can't put it into words. I don't know how I don't know how he did this. I don't know how he was holding it together, if he was holding it together at this point. Section 10 says that as a result of their negligence, Diana and Carlitos suffered permanent damages. So the lawsuit is seeking reimbursement for so many items that are listed there that they are more than obvious that they should get. They are also asking for a list of their staff, job descriptions, what their policy, procedure, and protocol should be, who their chain of command is, copies of all the records, video surveillance. They're asking for everything and anything to support the fact that when Diana got there, Diana was good. And when Diana left, she was not the same. You go into a hospital trusting that they know what they're doing. I've been to the hospital for labor and delivery twice. Not this particular hospital. I was going to do it in this hospital, but the doctor that I had was not able to deliver my babies in this one, so I went to another one. But you go in there thinking they know what they're doing, right? They're the professionals. They do this every day. They know the signs. They recognize the signs. They follow protocols. Protocols are in place for a reason. But as soon as Diana walked in there and they knew that she was in there for observation because of her preeclampsia, they did not put a competent nurse or staff to take care of what they needed to take care of. For Diana's sake. For Carlitos' sake. So tell me, was this Carlos's fault? What happened to Diana? Was it his fault? To finish this off, I just want to give a huge shout out to the lawyers that are supporting Carlos and Diana and Carlitos in this. Huge shout out to James Gerards and the Gerards Law Firm. They are located in Dallas. They are experts in medical negligence. He's number 5. He's rated number 5 of the state. And we also have a local law firm that's supporting Carlos, Diana, and Carlitos, which is a Zambrano law firm. So a shout out to Jesus Zambrano and to Edgar Garcia. You have a great team behind you, Carlos. I will be looking forward for more updates on this.